to the clouds. Yeah. Well, thanks everyone for joining us today. We have an amazing panel discussing on how we using system dynamics to teach and learn about COVID-19. And I really hope that by the end of this webinar, you learn how system dynamics can help to answer questions such as, is the pandemic over? We still have to wear masks, and other questions and much more that this panel discussed. We have Ali Mashahi from Iran, Babak Bahadin also, Danielle Gordon, David Enser, Hyun Jun Kim, and Luis Lunacase. And I just want to say thank you for you guys joining us today and for the sponsorship from the California State University, Chico, and the Rockefeller College of Public Affairs and Policy at University of Albany for sponsoring this webinar. It's only because of this sponsorship that we were able to make it free for everyone. I just want to remind a little bit about the benefits of being a member of the society. You get free access to all society seminar series, including the recording from previous ones. A great discount on our 2022 conference coming up in July. You get full access to the Society Scientific Journal, the System Dynamics Review, exclusive prices on our bookshop. And if you're planning to learn more about system dynamics, you also get access to a pool of mentors and discount on our partners' online courses. So it's a great way to develop your system dynamics modeling skills. If you want to learn more about these benefits, we have a membership orientation tomorrow at 11 a.m. There's also a more friendly time for people living in Asia. So you want to check the website for more details about this. And our conference is happening in Frankfurt and online at this time. After 2 years, we're meeting in person in Frankfurt. So if you want more information about the biggest event in this system dynamics field, you can go to systemdynamics.org/conference. And we have some early birds until June 9, and also member discount that you can become a member to get discount. And you can switch to virtual ticket without any penalty until May 24th. And you can upgrade to your Frankfurt ticket at any time. And if you plan to develop some system dynamics modeling skills after this webinar, we have the summer school with the best instructors in the field. We have an intro track and an intermediate track. If you know a little bit of system dynamics modeling, you can take a test for the intermediate track. I just want to give a big thanks to all society sponsors, especially Credit Human for being a benefactor of the society. And if you'd like to sponsor the society and help us continue breaking the ground for the system dynamics approach, you can email us at office@systemdynamics.org and we can start a conversation from there. And we're going to be collecting some questions throughout the presentation of all the panelists, and we're going to be using Poll Everywhere. So I'm just going to go ahead and invite you guys to test this platform if you're not familiar with. You can scan this QR code on your screen, or you can go to pollf.com/STS-polls877. There's going to be a link in the chat. Let me quickly do this. You can also click the link in the chat and get there, or scan the QR code. And the first question that I have for you is, where are you joining us from? This webinar we had around 100 people already, and we usually cover a lot of time zones, and today is probably no different. And I see people from Albania, Virginia, New York, some people also commenting in the chat. Thank you. Where else? India, the Netherlands, Canada, Dominican Republic, I guess. Where else? Houston, Bristol, Switzerland, a lot of cities in the US. I see some people in Europe too. I see you guys already got the idea of using this platform. So the idea is basically you can send, I'm going to turn on the Q&A very soon, and you can send your questions throughout the presentation. And by the end of the panelists present, they're going to reply to some questions, okay? And thank you so much for joining us today, everyone. Next slide. And this is not on yet, but the Q&A is going to be here. So now I'm going to just turn it over to David. he will introduce in more detail all the presenters today. And that's all from my side, David. If you want to go ahead and share your screen, you're allowed to do so. Thank you so much for being here.
Fernando, thank you very much. This particular webinar is being broadcast to you from Newfoundland Farm, a small sheep farm in upstate New York. And just to prove it, I'm putting on my sheep farmer's hat. As Fernando said, we'd like to thank Cal State Chico and Rockefeller College of Public Affairs for hosting us. And also I'd like to thank our faculty members from NASPA who may be joining us, faculties in public affairs. So I'd like to say a little bit more about our presenters. All 6 of these presenters have PhD level training in system dynamics from a good university, either University of Albany or MIT. Babek Bahadine, who you'll be hearing from last, is a consultant with IC Systems, a premier provider of both consulting and software. Hyung-Jung Kim is a faculty member at Cal State, and she's developed the learning modules that she'll be talking about. Luis Lunares is on the faculty at the University at Albany. He has been using a system dynamics simulator in his capstone public policy course, and he'll be talking about that. Dan Gordon is on the development team. In addition to being a system dynamicist, he's an epidemiologist with many years experience at the New York State Department of Health. Ali Mashayekhi is our lead modeler. He comes to us from Sharif University of Technology in Iran. My name is David Anderson. When I'm not doing system dynamics, I am a small-time sheep farmer, as witnessed by my hat. So I'm going to tell you a little bit about how this came to be, the Diaries During Lockdown project. In 2020, Ali Mashayekhi had been doing some modeling for the Iranian government. He called and asked about what we should do to publish it. It was Dan Gordon who had the idea that even at that time, many of the policy shops in New York State and probably at CDC were fairly modeled up. And he said that a better use for this modeling effort would be as a communication device with the public. And that's what we've done. Our modeling has been using system dynamics to try and communicate insights about COVID-19. So what we're going to do is just talk in order. I'm going to talk about the original Diaries project for a few minutes. Then Luis is going to talk about how he has used a simulator in his public policy course. Then Hyung-Jung is going to talk about some really, really fine teaching models that she's done. Ali and Dan are going to give you some technical details on the model, and we're going to wrap up with Babek, who's going to tell you everything you need to know to get information about this project. This is a screenshot of our homepage, and Babek's going to talk about this a little bit more. What this project is about is there's a series of stories, and they're motivated by the aphorism, think globally, act locally. So in each of these stories, there's some local activity on Newfoundland Farm, and the story tries to put it in the context of global thinking generated from the model. Early on, we were interested in the mode of explosive behavior. Later on, we were looking at recurrent surges and what were the dynamics which led us from one surge to recurrent surges, the second great mode of behavior that we're exploring in the model. There's a story here on the right about vaccines and skiing. It's not a story about David going skiing. It's a story about the dynamics introduced by the vaccine. There's actually a story that goes to the biblical prophets Micah and Habakkuk, and we're trying to talk about some of the ethical implications of this modeling effort. But what I want to spend some time on is the story called Even the CDC Has Flip-Flopped. This was a story that took place, it was timed on September 14th, 2021. That's important because that's exactly the date that Luis's case study is centered on. And it's a date when there was a convergence of 3 dynamic modes. And what it was about, it started with a story of a flip-flop in our church. We had a memorial service for a very dear member who had died. another dear member passed away, and we could not have a service because the COVID was coming back. So our congregation flip-flopped. The story noted that CDC flip-flopped also. And when you came to the bottom of the story, we noted that the flip-flop has something to do with the Delta variant and the introduction of a new variant. In the read more to dig deeper, it's one of the few stories where we actually showed model output. And this is a diagram which we're going to see a couple of times today. This shows the 3 modes that were convergent on September 21st, 2021, the date of Luis's case. That's that little red circle right there. What you see in green is a mode of recurrent surges. And we were talking about what are the dynamics? Why does this thing keep on coming back? Why is it surging? The next mode, the second major mode, was that yellow line, which is a damped, the oscillation is damped out, it becomes flat. And that's the mode induced by the vaccine. And that blue line is the initial surges damped out by the vaccine and re-excited by a new variant. This story also noted that this is a point where there was a bifurcation in simulated death rates. So these are the stories that were happening around September 21st, and these are the stories that we're going to be talking about. That's the introduction, and I turn it over to Luis.
Thank you very much, David, for this introduction. And as David is saying, then I am going to share with you in this section of the webinar our experience using the simulation as a core component of a capstone class for an undergraduate students majoring in public policy. And this part of the webinar will have 4 major sections, well, maybe 5 if I am efficient enough. I would like to start by talking a little bit with you, maybe the ones that are newer to simulation, why using simulation in learning about policymaking is useful. And then I will describe to you how we use Ali's model to develop this undergraduate capstone experience. I want also to share with you some of the results of the use, both in terms of learning from the side of the students, as well as their satisfaction or perceptions of learning. I want to give you a quick tour for the flight simulator. And then, as I was telling you, if I am effective enough, then we'll have some time to Q&A. So please don't forget to submit all your questions through the app or through the chat. So then let's get us rolling, talking about why using simulation in learning about policy making. You may have heard about this very famous case of a plane that had to perform an emergency landing just after taking off in one of the airports in New York City. Every reports of the event in the news was consistently saying that the pilot did absolutely the right thing. And when people was asking the pilot how did he perform this perfect landing or watering, I don't know really how to say it. So the pilot actually explained that he was able to do this perfect landing because he had done it before several times. And when people was looking surprised at him, he said, well, you know, we train using flight simulators, and then in these flight simulators, we usually get any time of situation, and we get a chance to practice those situations. So the case was so famous that actually inspired a movie that maybe many of you have watched, named Sully. And this is a picture of the original Chesley Sully Sullenberger III, who was that pilot landing this airplane. And in the movie, there is a simulator also playing a key role. These concepts of using models to practice skills is also widely used in management and public policy. And I want to show you a couple of pictures of experts in these fields that try to communicate why or how we can use these models. So this figure is from a paper written by my colleagues Marianne Jansen and Natalie Helbig. And in the picture, they try to suggest that mathematical models like simulation models can be used iteratively in the process of developing and refining policy as part of the modeling cycle. In this other paper from Hyung-Jun Kim and David Anderson and others, other colleagues, they are showing how we can use modeling and simulation to promote what the management literature calls double loop learning. So on the top, we can see how managers and public policy makers are working as they learning from the direct action. And then in their paper, they show a case where people is actually also learning through just thinking conceptually about the problem in what we call in system dynamics a causal map, and then how they can keep learning from a simulation modeling, enhancing the accuracy of their mental models. Now, the idea then of using a LIS model is exactly to develop some sort of lab where the students in a capstone class can actually practice just like Sully was practicing how to land their planes. And to do that, given that these students are not trained on system dynamics and they don't know how to use Vensim or any other of these softwares that we use to develop system dynamics models, we developed a web-based interface to interact with the model as a flight simulator. And we developed case materials and a set of tasks and activities that were all oriented to practice and develop skills. The course, it was a 14-week class, and the first few weeks we were using Eugene Bardak's and Eric Patashnik's book on a practical guide for policy analysis, learning about the policy process, the Eightfold Path, how to assemble evidence, how to manage misinformation. And then during the second module of the class, we were all working about this case study that was set in a fictional place called Albany County, Michigan, and working with the simulation. The major learning outcomes for this capstone experience was or were to demonstrate knowledge and understanding of public policy issues and analytical tools, to communicate complex ideas clearly and persuasively in both written and oral forms, to evaluate apply theoretical and empirical work in policy relevant research, and to apply some skills and knowledge acquired to analyze policy issues. So, as David was saying, we wrote a case that was named Managing COVID-19 Mask and Vaccine Mandates in Albany County, Michigan, and what to do when public health becomes politicized. And the case is set in the late summer of 2021, just when we were thinking that we were off the hook from COVID. And the case is set up in Albany County, Michigan, that for many practical reasons, we decided in the case that was demographically and statistically very similar to Albany County, New York, where that is the place where the students are living, so that any research they could do about data in Albany, New York could be also applied to Albany County. And in the case, there is a mention of the Disease Control Department that shares many features with the Center of Disease Control here in the United States. And there is a central character in the case, Ellen Wortley, which is the role that the students are playing. It's a recent graduate, several weeks into her first job as an assistant manager for Sean McAllister, an elective county executive who is facing re-election and dealing with all the disruptions caused by the pandemic. So the task for the students was to work with a task force that involved multiple stakeholders like the Commissioner of Health, the CEO of the Chamber of Commerce, the chair of the school board, and the press secretary of Albany County to draft a policy memo with options for managing mask, testing, and vaccine mandates, including recommending which of those options are the best, working with this task force to reach consensus. And here you have a more detailed view of those 8 weeks. So we kick off with introduction to the case and some team formation, did some stakeholder analysis using data from the case, and we got ready to have a conversation with the task force that we were calling the panel in this class. The panel actually visited us on the third week, and this is the panel. So we had in the classroom Michael Bresling, a former Albany County executive, Elizabeth Wallen, the Commissioner of Health for Albany County, Mark Egan, the President and CEO of the Capital Region Chamber, and Kerry Bichet, the Press Secretary for the Speaker of the Assembly, and also some other usual suspects, my good colleagues, Ramon Gil Garcia, Dan Gordon, and David Anderson, who were playing other characters in the case. So then we had the real people in the case from Albany County talking with the students about their experience managing and developing policy for Albany County during the crisis. After that, then we had a debrief from that conversation. Students learned a bunch of new things from talking with the real actors managing the situation, and we developed a bunch of hypotheses that to get ready to run the simulation. And then we ran the simulation 1 week, and then we had a debrief with the developers. And then Dan Gordon and David Anderson came back to the classroom to talk with the students about their experiences using simulation in developing policy. And the conversation was actually how to use all those different simulations and runs and how to communicate learnings and insights from the simulation as the students were already writing their policy memos. They keep working in teams and prepare some posters, and then some members of this panel came back to talk to the students. And here we have Mike Wrestling that was very generous with his time and came back talking with the students about their options, their policy options. And then we had a final class to reflect about the whole experience. Now, let me share with you some of the results of using the whole experience with the students. And I want to start sharing with you some of the comments from the students. Their final assignment was to reflect on their own learning. And every memo of the students in this class was different and emphasizing in different aspects of the experience that were the most relevant for them. So one of them, for example, said or was really enjoyed that session of questions and answers with the actors, and then they wrote in their memo, through this case study, the task force was one of the most significant tools we use, and I hope that in the future I will be able to work in similar contexts. Another one was really emphasizing on the things that they learned from the simulation, and they were writing, in the end, our policy proposal was actually a lot of smaller pieces that each could make an impact. If you have a few items working at a reasonable 60%, then you will get better odds in the end than forcing one thing to work at 90% that will not stay feasible in the long run. And they were talking about how require everybody, 90% of the population to be vaccinated or to wear masks. Maybe the long run is not the best or most sustainable or most feasible option, but how through the simulation they learned that a combination of these policies could be as effective as forcing everybody to do something. Even the presentation was an opportunity for all of them to learn. And one of them wrote in their memo, during the presentation of our recommendations, the task force members asked questions and brought up topics which did not cross my mind in planning. Such questions included staffing requirements, budgeting, enforcement, and how receptive the public will really be at this stage in the pandemic. And of course, the group or the team experience was also important for them. The most important thing I learned from all this is that to get work done, you need to work as a team. So in general, good reflection from the students. And we also tried to measure. This was a small class. I had 14 students. And then the day that we were running simulations, we gave them a satisfaction survey, and then in a scale of 1 to 5, on a Likert scale, you can see that they were in general satisfied with the experience of using the simulation and the clarity of the materials that we were using. And we also did a pre and post test on their understanding of the dynamics of the pandemics. And these preliminary results show that they learned something through the experience of using the simulation. Now, let me now move to a quick tour through the simulation, and I hope I'm doing fine on time. And I just want to show you the general interface, and then I want to reproduce those 3 behaviors that David was describing in this main article of the diaries of during the lockdown. So let me see if I can be successful in switching to the simulation. I hope you're all now looking at my at the simulation that starts with a welcome message from the DCD head scientist, and then it has an overview of the main structure of the model behind or under the hood. I won't describe that because I know that Dan is going to be speaking about this structure under the hood with much more detail later in this presentation. So then I just click on getting started, and then the simulation takes me to the base run, or this baseline, where we can see in the same simulation that David was showing to us, where we can see all the surges of the pandemic without doing anything about it, right? But then in order to explore different effects, there is a several scenario or policy features that people interacting with this model can use. Then in mode 1, we have those aspects that are only relevant to understand the dynamics of the epidemics, characteristics of infectivity, fatality rate, and issues or elements of the introduction of a new variant. And in mode 2, we have what we are calling social and government response, or human response. So people can be just more cautious. There are some government policies. There is, of course, vaccination. And then let me show you, for example, just for illustrative purposes, how just introducing some moderate social response from the population can change the dynamics of the pandemic, just like David was showing to us in the original article. And then you can see how just better behavior and habits from people reduces the surges and the impact on terms of incidents and deaths and hospital pressure in a very important way. Now, if we add to this social response also a vaccination program that introduces a vaccine that has, let's say, 80% effectiveness, and 80% of the people wants to get vaccinated, then you will see how after day 180, which is the day when this vaccine gets introduced, the dynamic change. So let's call this moderate response and vaccination, and then run the simulation. It's a little slow because there is a bunch of data points that need to be redrawn every time that the simulation is running. I will just get rid of the baseline so that you can see better the comparison of the vaccination and just the social response. So you can see how after the first 200 days, as people gets more and more vaccinated, so the dynamics change. And then in the lab that I was working with the students, we had many of these different runs, and then we were just talking about what were those effects or causes of those changes in the behavior. And I don't know how am I doing in time. I hope I'm doing not too bad.
Hi, Luis. We have around like 2 minutes.
So then why don't I stop there? Because people can come later to keep working with the simulation. And then let's take these last 2 minutes just to see if we can answer any questions. Can we do that, Babek?
Yeah, sure. There is one question up there, and the question is, what similarities and differences have you observed between the results from your use of a flight simulator with a panel for understanding how to manage COVID, and similar teaching learning exercises with system dynamics for other topics, if you have worked with them with other topics?
Yes. So I think that the two experiences were complementary. I think that the work with the panel actually taught the students, or it was very emphatic on the importance of the communication side. So if you ask me, in this particular instance of the experience, I think that the major learning from that was the importance of engaging stakeholders and keep them consistently communicated through all the different channels. And I think that what they learned from the simulation was much more about the effects of how this is used. And I have used other simulations with master students, and I have used other simulations also with public managements on training. So in general, I think that all these different flight simulators really are helpful in order to help people to think about hypotheses on how policies work and how their actions may have different impacts over the policy system. And so in that sense, I think that is a consistent experience using this type of simulation. These are good tools, and many times they are puzzling. People don't understand why things are changing, but then there is a lot of discussion and conversation that can help to improve that understanding of why the unexpected behaviors that are being seen in the simulation.
I'd like to jump in here just quickly. NASPA, which is the organization that accredits schools of public affairs and public policy, has been running simulation exercises on an international scale for the last 5 or 6 years. And I think they have accumulated significant experience on using simulators in the public policy environment.
Yeah, that's right. Thank you. Thank you, David. That's true.
All right. Thank you, Luis, for your presentation. After we have multiple speakers and multiple presentations, after each presentation, we'll try to cover 1 or 2 questions, but at the end of the meeting, we will have 10 minutes for Q&A. So if you like to post your question on the poll, we will check them out at the end of this meeting. So without any further ado, next presenter, Yoonjan Kim. Thank you.
Thank you. So my name is Hyunjang Kim, and for this part 3 of the webinar, I'd like to share with you some of the system dynamics teaching and learning resource that you might find useful. So the goal of this part of the webinar is I'd like to introduce you to the self-study learning module that we have created as part of the diaries during the lockdown project. I'd like to talk about what are those learning modules and how to use the learning modules, but also why you want to invest your time and check out these learning modules. And then I'll give you a short snapshot of what is actually available in those learning modules. So that's my goal. Oops, hang on a second. It's just moving. Okay, so As you have seen in Luis's presentation, students can actually learn to make good policy decisions by playing with a simulator. So you enter decisions into the simulator, and what simulator do is they generate outcomes of those decisions. And by playing with different decision combinations, then you get to learn what decision works better and what you should avoid. And that's some of the things that you learn. However, sometimes you might wonder what is actually behind the simulator, what is processing those decisions to generate outcomes. So in this part of the webinar, we are actually going to be looking behind the simulator and explore what is the model that's making all these connections. So as we have talked before, what's behind Luis's simulator is Albany's COVID-19 model. So what you're seeing here is a screenshot of the final stage of Albany's COVID-19 simulation model. And what I'm trying to do here is build a learning module that's going to help everyone to build Albany's model step by step, even if you know nothing about system dynamics. Okay, so if you have a model like this, then you can start using it for different things, like to answer your personal questions, or to understand more about the pandemics, or you can simulate the model and get answers for when the pandemic's going to end and all these things that you're wondering about COVID-19. Okay, so what can simulation models do? Why do we want to build simulation model, and why do we trust simulation models? Well, models are better than our opinions or simple guesswork because they represent scientifically established facts and theories using mathematical equations. And we calibrate these models using real-world data. And we can actually use these models to understand what's going to happen under a different set of assumptions or different scenarios. So you can basically think of it as model being way to overcome our bounded rationality. Okay, so all of Albany's model is particularly helpful because the model structure reflects what epidemiologists know about how the infections spread over time and how the public might respond. And we have calibrated against real-world data. And you can use the model to understand what would happen under different conditions, such as having vaccine or having multiple variants. And it uses system dynamics modeling approach, and it brings a unique set of analytical framework that comes with a system dynamics approach, which is particularly helpful for dynamically complex problems. Okay. So we will teach you how to build and simulate Albany's COVID-19 model. So I want to talk a little bit about the key features and strategies that I have used in this learning module. So first of all, we want to learn system dynamics from a compelling case, which is COVID-19. And we are replicating Albany's model step by step from scratch. And while we do that, we're going to learn key system dynamics concepts and techniques. So that's different from typical introductory course in system dynamics, because we will teach system dynamics techniques and use examples to apply those techniques. So it's kind of flipped around. And we will build on David's story, everyday story, to highlight the real world implications of the modeling process that we have. And I have been teaching system dynamics in an online asynchronous environment for the last 2 years. And there were some of the things that I found to be important and quite successful. And I tried to leverage on those successful practices in these learning modules. So I particularly paid attention to how I create content, and I tried to reduce a lot of reading and try to use more visuals. And also I try to make it really easy to navigate because it's a self-guided study material. So it has to be easy to navigate, but also the progress and achievement has to be easily visible. And I try my best to make it fun and hands-on. And even though it's an asynchronous self-study module, I try to be there, have as much presence as possible. And I try to use a simple non-technical language. And what you will see is the virtual classroom, which I call with my student, and it's going to be in Google Slides, but all the things that you need to know in order to complete that module is incorporated into the slides, including YouTube videos. And then also, you will see my avatar popping up here and there, trying to communicate some of the important points, okay? The learning goals of my learning modules. Well, when you have completed the learning modules, you will have a full COVID-19 model replicating Ali's original model, and you will understand various system dynamics modeling techniques from beginner techniques to more advanced ones. And then you will be able to apply these modeling techniques to other problems beyond the COVID-19. So that's the goal. And so let's say that you want to learn to build this model. What do you need? So first, you need to access the self-paced learning module from the Diaries During the Lockdown website. So later, Babak will show you how to access it. And then one of those modules will be called Prep module, and it will introduce you to the basic concepts in system dynamics, because you do need to know some of the language that we use to understand the learning module. So there is this prep module that you might find useful if you are new to system dynamics, but also if you're teaching system dynamics to a student for the first time, or introductory course in system dynamics, or you're communicating with your client who doesn't have background in system dynamics, then you might find this prep module a good tool for you to use. So you might want to check that out. Also, we need simulation modeling software, and there are a lot of different softwares that's available, but we're going to be using VenSim PLE version. It's a software that's used by a lot of modelers in the system dynamics community. Ali's model is built using VenSim. It's a very powerful software, but also it's free for educational use. Okay. So if you go to the website, that's the place that you want to click, the resources, and you're going to see the table of content. And the first two modules, those are the prep modules. So the prep one is what I just mentioned, and prep two talks about why you want to build simulation model and what benefit you can get. It explains it in a more simple everyday words. And then all these modules explain step by step how to build Ali's model. So you're going to start from module 1, and we start with the very generic, epidemiology model called the SIR model, and we are moving a population from susceptible population to infected population, and we're going to keep building onto that. And when we get to module 5 and 6, we actually incorporate some of our social responses to the severity of the disease. And then we talk about the hospitalization, we add a quarantine policy, and then later we add a frustration, vaccination, variants. And we expect these modules to go up to module 13. And as you can see, we are about 2/3 way into these modules. I also want to share the license type that we have. It's licensed under a Creative Commons, and we try to provide the most flexible type of license for the users. So you can copy, redistribute the materials that we have here, and you can freely remix and transform it and use it for any purpose that you like. Okay. So before we move on, for those of you who are completely new to system dynamics, I want to talk a little bit about what we are trying to achieve here. Okay, so in system dynamics, we think about how system structure generates system behaviors. So if you're trying to change a system behavior, then because system structure generates the behavior, you have to change the system structure. So that relationship is really, really important theme throughout the system dynamic study. And there are a lot of, few conceptual tools that we use to describe system structure. First one is the causal relationship between two nodes. So we have positive and negative relationship. And then when these relationships create circular causality, we call that feedback loops. And there are reinforcing and balancing feedback loops. And then we also pay attention to stocks and flows. And stocks represent accumulations in the system. And then flows, like inflows and outflows, those are the rate at which the stock levels change. So these conceptual tools together, they describe system structure and they create patterns of behaviors in the system. So here are some of the very common patterns of behavior, and they are related to different types of feedback loops or combinations of feedback loops and stocks and flows, okay? So what computer simulation models do is testing this structure and behavior relationship. So we are describing the system structure using mathematical equation in computer simulation model. And when we simulate the model will generate behavior. And we are testing out the structure and behavior relationship, and we gain better understanding about the structure of the system, okay? All right. So when you go to the module, each module will have a very similar structure. Okay, the length might be different. Some modules have a end very short, other modules are very long. However, it has a very similar structure. So it starts with one of David's story. Okay, and then I will define the learning goal for that module. So in this module, what structure are we adding to Ali's model and why are we doing that? And in doing so, what kind of system dynamics concept are we covering in this module? So I'm gonna define that, and then I'm gonna explain the new structure that's gonna be added in that module, first starting with the feedback loops, and then stocks and flows. And then later, I'm gonna define those things using mathematical equations. And then we're gonna move on and build and simulate the model. And I explained that process using YouTube video. And we'll discuss the simulation results and we discuss implications. So for example, what assumptions, sorry, it's keep moving. I didn't unclick the timer here. So what assumptions are we making and what needs to be modified? And then I'm going to tie it back to David's story. And then we will wrap up by introducing what's going to be covered in the next module. Okay, so here is a snapshot of module 1, which is the very, very first module. And it is tied to David's story, How to Stop a Pandemic. And this story was published in April of 2020 when the US was going into its very first like extreme social distancing, and in some areas there was lockdown, okay? And here David and Deborah, they are considering going to a local ice cream convenience store to buy ice cream, and they are wearing face masks and they feel very awkward, right? Because, you know, we're not used to wearing face mask at that time. So relating to that story, we are talking about two different types of population here, the susceptible population and infected population. And there is a flow, right? From susceptible to infective. And we call that flow rate incidence rate. Okay, that's a new number of people newly infected per day. And we are talking about what changes that incident rate. And that is the context between people. Oops. Okay, so here we first talk about the feedback loops, okay? That's gonna increase the number of infected population because more infected people that we have, we will spread the disease faster, right? Higher the incidence rate. And as we are having more people infected, we're gonna deplete the susceptible population. So we talk about the dynamics, and then we will translate that into stock and flow diagram. And we see here, susceptible population moves through this pipeline to infected population. And these two populations make contacts. And there is this number of contacts that people are making on an average in a given day. And that's gonna create infection. And there is this variable called infectivity, which represents number of contacts that's actually gonna lead to an infected cases. So here I describe all these variables, their implications and the equations. And then here is a page where there is a YouTube video, which I walk you through building this particular segment of the model. And then we will simulate the model together and explore what actually happened, okay? So that's a snapshot of some of the slides. And then what we are seeing here is how this structure generates this behavior, okay? And a lot of you will be familiar with this model. And basically all the people who's in the susceptible population, they end up being in infected population stock. And that takes place in about 30 days, right? And we relate this behavior to the feedback loops, but also we talk about what's gonna speed up or slow down their process, you know, rather than 30 days. And it really comes down to two of the variables in this model, which is contacts per day and infectivity. And contacts per day actually relates to the David story, like should we go to the ice cream store or not, right? And infectivity has to do with whether should we wear a mask or not. So those are model variables, but actually they have real world implication. We also talk about the assumptions made in this model. For example, here, the infected population, they stay infected forever. There is no outflow, and they're gonna spread the disease for the whole duration of epidemics, but that's not true, right? So in this case, we talk about how we're gonna relax that assumption in the next module, okay? So I'm gonna skip to module 5 and give you a little flavor of what module 5 is about. It has to do with one of David's story again, but it also has to do with how we adjust our number of contacts based on what's going on with the death rate from the COVID. And here we are seeing some of the headlines from the newspapers where they talk about how the government is extending the lockdown policy because the death rate is too high. So we're gonna capture that in our model in module 5. And basically what you're seeing here is now we have susceptible population who is divided into two different types of infected population. One has symptom and the other one doesn't have symptom. And some of these symptomatic population, they're gonna recover and some of them will die. And from that death rate, okay, we perceive the severity of the disease. So there is this perceived death rate, which will have an effect on the number of contacts per day, and which will have an effect on the incident rate, and that's going to have an effect on the death rate, right? So when the death rate is too high, we're going to reduce the number of contacts, and that's going to, down the road, actually lower the death rate. But when the death rate falls, we're going to actually increase the death contacts again. So there is this balancing mechanism that's going on. And here we are actually studying the system dynamics modeling tool that has to do with information delay, where we are looking at the data and we are forming our perception or judgment about how serious things are. And then we're going to talk about the nonlinear relationship here, where the 1 unit of change in perceived death rate does not necessarily lead to a proportional increase or decrease in number of contacts per day. So we talk about how to use graphical function to capture that nonlinear relationships. Okay. So this structure will generate this behavior. And here we'll start seeing this oscillatory behavior, which is similar to the waves of epidemics that we are experiencing in real world. And then we talk about how we can see variations in these oscillatory behavior based on how responsive we are to the rising and falling of the death rate. And then in the next module, we talk about what quarantine does to this, or how hospital capacity affects this. So I want to stop here, and the next step is we want to complete the development of the learning modules by the end of this year. That's my target. In the meantime, we encourage everyone to check out the learning modules and let me know if you have any questions or feedback, or how I might be able to improve the learning modules. And also let us know if you have additional support materials that you would like us to offer. And if that's something that we can do, we'll be happy to look into it and incorporate that into our project. So thank you.
Okay, great. Unfortunately, we don't have that. We have multiple questions, but we don't have time to answer them right now. For those that are new to this session, we are going to have Q&A at the end of the meeting. Next presenter, Dr. Ali Mashaikhi. Doctor, you're on mute.
Okay. Hello, this is Ali Mashaikhi from Sharif University of Technology in Tehran. I'm going to present the basic structure of COVID-19 model. Let's start with the first. We start with the flow of people. We have susceptible who, when get infected, flow to asymptomatic people who are infected without any symptoms. After a while, symptoms appear, and then they flow into symptomatic patient, and then from there some recover and maybe some would die. The recovered population, after losing their immunity, flow back to susceptible. The net rate of incidence or infection rate depends on the number of contacts between susceptible and infected, either asymptomatic or symptomatic, and infectivity. This structure doesn't have any feedback from death rate to incidence rate, and doesn't have any feedback from death rate to the way that people behave. So the first feedback loop is here. When death rate goes up and is perceived, it will affect the number of contacts. People become more cautious. They will keep social distancing, try not to meet many people as they used to, and the number of contacts would decrease, and therefore the incidence rate would decrease. And this is the first negative feedback loop that, due to death rate, controls the incidence rate. The second loop is again from the death rate. When it's perceived and is increased, will increase hygienic behavior by people, which means more people will put on masks, they will wash their hands more frequently, and as a result, infectivity would decrease, and that would decrease incidence rate too. So this is a negative important feedback loop that controls the incidence rate. The next slide shows hospitalization. When symptomatic patient, the number of symptomatic patients increases, that with increased demand for hospitalization. And if hospital capacity is not adequate, hospital availability will decrease. And if hospital availability decreases, that would decrease recovery rate and would increase death rate. In fact, in some societies, on the peak of COVID-19, hospital availability became an issue, and that affected both recovery and death rate. The next slide shows when symptomatic patients go to quarantine, when death rate increases, that will make people more sensitive, and those who have symptoms might go to quarantine. And if they go to quarantine, the number of symptomatic who will meet, who are not in quarantine, and will meet susceptible would decrease, and therefore this is another loop controlling the incidence rate. The next part of the structure deals with frustration and fatigue. In fact, when social distancing continues, people might get tired and frustrated of living alone and not meeting friends and families. Because of that frustration, they might go to and meet their friends, their families, and therefore they will decrease the impact of death rate on number of contacts. So as frustration goes up, people will not follow social distancing, and then the number of contacts would increase, and that will increase incidence rate. The next slide has to do with government lockdown. When death rate goes up, in some societies, governments are very serious to enforce lockdown and do not allow people come out of even their home. They will close the businesses, and lockdown will decrease number of contacts, and that will decrease incidence rate. For example, in China these days or last month, lockdown in Shanghai was very serious. The next part of the structure presents the testing. When COVID-19 is serious, in some societies, people who do not have any symptoms will take tests to see if they are infected. And by testing, infected people would be identified and they move to quarantine. And if they do go to quarantine, of course, there will decrease the number of infected who would meet susceptible, and that will control incidence rate. Those who go to quarantine and are infected, after a while, the symptoms appear and they move to symptomatic group. Or some of them might recover, perhaps, and go back to recovered population and then flow back to susceptible. Next is vaccination. To take care of vaccination, we divide susceptible people into two groups. One willing to take the vaccine and the other unwilling to take the vaccine. And people unwilling to take the vaccine might flow to willing or vice versa. When death rate goes up, maybe more unwilling to take the vaccine would move to willing, susceptible, willing to take the vaccine. And then people susceptible, willing to take the vaccines, and vaccination capacity, when vaccination capacity is built up after vaccines become available, vaccination capacity and susceptible, willing to take the vaccine would determine the rate of vaccination, and then people flow from susceptible to vaccinated population who are immune from getting sick. Of course, the effect of vaccination might disappear after a while, and they might lose their immunity because of vaccination and get back to susceptible. Either susceptible willing to take the vaccine again, or they might move to susceptible unwilling to take the vaccine. And those who are vaccinated might get infected because vaccines might not be perfect. And those vaccinated, infected here will recover maybe after a while and move to recovered population. And if we put all parts of the model together, we get this picture, which is not really a big model, but has lots of feedback in it. And Dan is going to simulate the model and shows some of the behavior and the impact of some policies. Thank you very much. And if there is any question and we have time, I would be happy to answer.
Dr. Mashaki, we have a couple of minutes and there is a question that you may be able to respond to. It is, they want to know the data that was used in the model. Is it a hypothetical case or is it the case for Iran or Albany?
Actually, see, this is a generic model. When I developed it, I used a population of Iran, which is 80 million people. But, you know, I think then we can change the population to represent Albany or the United States. What we focus is the dynamics coming out of this generic model. And the parameters, for example, how long does it take for the symptoms to appear from asymptomatic to in asymptomatic people, so they move to symptomatic. These are just some average number that specialists, gather from the real world. Or if under normal conditions, a certain percent of people who are symptomatic would die, but then this death would be modified by the availability of hospital, if hospital availability becomes an issue. And the number of bed to population was initially was statistics from Iran, but I think Dan maybe modified for the Albany County or the United States. So what we are focusing here is, or presenting here, is a generic dynamic model that can be adjusted for particular situation.
Okay, thank you so much. We talked about Dan multiple times in the past presentations. He is the only real epidemiologist among us. So let's move on to Dan's presentation, and he will talk about how the simulation was used for analysis.
Thank you.
Thank you. Okay, Dan, you're on mute.
Okay, now I was saying that it's been kind of a long morning. We've used up most of our time, but I'll try to keep you from falling asleep over the next 10 minutes or so by showing you some examples of how we actually used our simulation model to look at some of the situations that arose and are described in the diaries from lockdown stories that David described earlier in this presentation. These are real examples of our use of the model. As I said, David has mentioned that these underlay some of the stories. This model, almost exactly as you're going to see it from me, it underlies the flight simulator that was used in Louise's public policy course. Ali mentioned that there were numerous sort of control mechanisms within the model. Some of them are turned off here. We're not using the frustration module, and we're not using the government lockdown module in the things that I'm about to show you. However, the testing policies actually are on. I'm going to be showing you two examples that explore how the epidemics course is affected by variations in vaccine effectiveness and the infectivity of the virus. In these slides, we're going to be looking mainly through the lens of incidence, a measure that epidemiologists love. It's the number of new infections per day that occur in the population. Our first example is asking, how important is vaccine effectiveness? Now, vaccine effectiveness is defined as the percent reduction in new infections that you see in a vaccinated test group versus the control group. In other words, if the test group shows only 10% as many infections as the control group, then the vaccine would have a calculated 90% effectiveness. We look at effectiveness levels between 10% up to 90%, and we hold the population willingness to be vaccinated at 70%, which is fairly representative, at least for the Northeast United States where we are. So here are 4 curves, starting with a gray curve for 10%, blue curve for 30, red curve for 60, and the green curve for 90. In this very first part of the simulation, all these curves are overlaid, so you can't differentiate among them. We've got 720 days of simulation here. The y-axis shows you the number of infections per day that are occurring, and our vaccination program starts to become effectiveness somewhere here around day 90. And it's very clear, just glancing at these curves, that successively higher levels of effectiveness greatly suppress the epidemic. The 10% effectiveness doesn't do much, although we're not showing you the curves for total lack of vaccine. 30%, a little bit more. By 60%, we're seeing very substantial suppression of the epidemic. And by the time we're down to 90%, well, the epidemic, it has become, it has simply becomes endemic. There's a long, slow progress of the epidemic here. The observations I want to leave you here, though, are that the vaccine has an effect on the amplitude of these variations, of these surges. It also has an effect on the timing of the surges. You see the time between the surges gets stretched out. But most importantly, with a high level of effectiveness, the surges go away. So the vaccine also affects the mode of the epidemic, how it behaves. The second example asks what happens when a new viral variant is introduced in the model. This is exactly what happened here in the Northeast US. Well, I'm in the Northeast last summer when the Delta variant emerged. To model this, we have to change the infectivity of the virus. Now, there is a base infectivity, which is simply a property of the virus, but that in itself is not enough to calculate numbers of infections. We have effective infectivity, which depends on interpersonal contact rates and hygiene behaviors. And the total incidence rate in the end depends on the effective infectivity and on the fraction of the population that's already infected. To do this simulation, we steadily increase the viral infectivity to a new higher level, roughly twice that of the original, over the course of 100 days. We also need to change the effectiveness of the vaccine because the original vaccine is less effective against the new variant. What vaccines do would be to affect the probability of transmission at each contact, but also things like the probability of severe illness and the probability of death. In our model, we're going to be steadily decreasing the vaccine's protective effect on the probability of transmission. The probability of severe symptoms and death is left the same as it was for the original, which, by the way, seems to be roughly correct in the case of the Delta variant. Sorry. There are some things we don't check, we don't change. We don't change the population's behavior, the kinds of responses to the death rate, the changes in contacts and hygiene. We don't need to change those because those are already built into the model. They're endogenous, they're there, they're going to happen anyway. We don't change the population's willingness to be vaccinated in these runs that I'm about to show you. We're holding it constant at 70% throughout the simulation. two reasons for this. One is that we experimented with variable willingness and discovered that for fairly high levels of willingness, it doesn't make much difference whether you have the willingness as fixed or responsive to the death rate. Also, if we hold the death willingness constant at 70%, then that removes one entire factor out of our evaluation of the behavior of the virus and the vaccine. So it just makes the analysis a little bit simpler. This graph is not shown to present to you results, but just so that you'll know how things worked. The blue line shows incidence rates throughout the course of the simulation. What you need to get from here is that somewhere around day 180, our vaccine program comes into effect, and the fraction of people who are vaccinated goes up and up and up until around day 360, 320, it reaches 70% and stays there. The other event that happens is that around day 450, the characteristic of the virus starts changing. The original virus is replaced slowly over the course of 100 days by the new virus, and the characteristics are blended from the beginning to the end. Now, here are the results. This is a graph you already saw from David. We've got sort of three phases of results here. One, the behavior of the epidemic when there's no vaccine. The second, where we add the vaccine around day 180. And the third, when we add the new variant around day 450. So here is the, in green, the epidemic without any vaccine. And you see a sequence of surges. When the vaccination program becomes effective, there's still one last surge here because it takes a while to get everybody vaccinated. But then the surges largely disappear and we lapse down into a steady state. If, however, we bring in the new variant at day 450, we go back to a regime of surges constantly going up and down. Let's look at this from a slightly different point of view. Let's look at the cumulative cases rather than the actual incidents to see how many people are being affected in total. And here is the original epidemic going up and up. Each one of these steps corresponds to one of the surges. When the vaccine comes in, the surges go away and the slope goes way down because the number of new people being infected is much lower. When the new variant appears, however, there is the slope of the cumulative cases. And what you can see is that this slope here is pretty much parallel to that slope, the green slope, which means that once the new variant comes in the total population, the actual number of new cases that we're seeing is the same, very similar to what we would have seen without the vaccine and without the new variant. Let's break down that rate, though, between different pieces of the population, because we have here in this green simulation, everybody is lumped together. But by the time we get down to here, the blue simulation with a variant, we've got two distinct populations. We've got the vaccinated and the unvaccinated. They fare differently. In this slide, we're looking at deaths per 100,000 per day. Why deaths? Well, this just happens to be the slide which was available to me when I was putting together this presentation. The graph for incidence per 100,000 per day would look very similar. Here are the lessons. When the vaccine becomes available, the numbers of cases, of course, go down, and the case rate among, or the death rate, even among the unvaccinated, goes down. Why? Because they're shielded by the 70% of the population that is vaccinated. Once the new variant appears in here, their rate goes back and it bounces up into the same level that was seen even when there were no vaccinated people in the population, roughly. Although there are people vaccinated, the vaccinated show a far, far, far lower death rate. And the fact that there are 70% of them who are vaccinated is providing some protection even for the unvaccinated population up here. The cumulative death rate shows very clearly that it's far, far better to be vaccinated than to be unvaccinated, even though the vaccine is not quite so effective against the new virus. What are the observations and the lessons that we have from this? Well, for the vaccinated, the new variant is a setback, but they retain substantial protection. For the unvaccinated, the new variant cancels out the benefit of any limited herd immunity that provided by the majority of vaccinated population. But it's important to note that this penalty on the unvaccinated does not just apply to those who refused vaccination. They're not the only ones who are, quote, the losers. There are many of the unvaccinated who can't be vaccinated. They can't be vaccinated safely or effectively, and they're at a much higher risk through no fault of their own. The increase in incidence that we see with the new variant shouldn't be interpreted as meaning that the vaccination is not an effective strategy, not at all. Without the vaccine, the global incidence rate would be much higher. I'm not showing those simulations, but we have done them. And that, folks, in a nutshell, are some of the real situations that we investigated for David's diaries from lockdown stories. I expect that the things that I've shown you right now would prompt enough questions for us to go on for hours, but I won't. So thank you very much.
Thank you. Can you hear me? I don't know. Yes, and then
Hear
can
you.
you see the new Fathom Farm screen? I'm not sure if.
We hear you, we see you.
Okay, we are a little over time, so I will try to be quick. Thank you for being patient so far. So we have a website for all the activities that you saw on this on this meeting. The first page, it's the main address that you need to know is newfathomfarm.org. From here, you can have access to all the material. The main page is for all the activities that happens, not all, like covering some activities on the New Fathom Farm. That's where David and Deborah and their family lives. You can see that here, there are mainly 2 projects happening at this point. There's Diaries During Lockdown. That's the one that we talked about. And then there's another one, which is really interesting. And I will not go for the details, but check it out. Friends of New Fathom Farm. So if you know Roberta Spencer, the previous executive director of the Systematic Society, she has done some activities to teach grandchildren some skills that could be transferred during the pandemic. So check it out, and you can see some explanations about that page. The latest diaries will be posted on the next item on the menu. We have diaries after lockdown and we have diaries during lockdown. David talked about this a little bit. I will move forward. Resources. On the resources page, you can have access to the latest version of the model that we use. We periodically update the model based on the analysis we need. YouTube channel that we have includes all the presentations and all the tutorial material that Hyun Jang provided and the presentations that we had in the past, and we hope that we can also upload this presentation. And there you can see some slides and the original version of model that we used. Okay, on the resources page, next item would be learning material. That's what Hyun Jang talked about. You can see a step-by-step material that you need to know to replicate Ali's model. It's in progress. We are up to module 8. We hope that it goes on with more modules. The next item on the resources menu is classroom activities. That's related to what Luis presented today. So almost everything you need to know about the class that Luis instructed can be found here, including the assignments, and they are like fully explaining what kind of tasks students should go through. The next item, which is an interesting one, probably so many people ask for that, is how to access the there is a typo here. I will fix that. COVID-19 policy simulator. So here you can see, you can find the manual here, how to use it. And here you can go to this website and you will find this. This is public, as Yunjang explained. We have Creative Commons license. So, and it is the one that like the Wikipedia use. So feel free to use the material in any ways that you would like. At the end, we have about us. If you need to know about our background, you can go here. Especially, you can find our email address here. If you want to contact us, you can send an email to this. All the members will receive that email and will respond to that. The last item is newsletter. So we're trying, after each update on the website, including a new story that comes with diaries. So David explained that if a new story gets up there, we will send it through newsletters. You just need to sign up. We will do the rest. We have noticed some technical difficulties when signing up. It's maybe the confirmation email goes to your spam folder. Please check that out. I've explained it. When you click on this, another page will show up that explains that. But if it goes to the spam, please make sure that it goes to your inbox, and you can also put our address as a safe sender so that you will always have our emails. All right, we don't have that much time, so I will go straight to the questions that we have for the speakers. Let me start.
Babak, if you allow me, I'm going to share my screen so we can see the questions at the same time as you read them.
Absolutely. Okay.
This is ordered by popularity, but you can definitely answer any of those that you would like to. Those are directed for specific or presenter, I think.
Okay, I think
maybe.
Yeah, the first question, I think, David, it would be great if you can explain that for us.
I can also just share a little bit. So I think that there is no need of system dynamics knowledge. There was some conversation in the chat too. Students didn't have any class before to learn about system dynamics. And even though I know some system dynamics, I never use any of that knowledge for the sessions. I think that the focus of the materials, as we were discussing in the classes, just to discuss about learnings and insights. And I think there is, if you ask me, I think that knowledge on how to run case studies and knowledge on some basic knowledge on epidemics may be more important. But maybe David wants to also.
No, I had another question for David. That was not it. Yeah. And thank you so much, Luis, for responding all the questions in the chat box. The question that I have for David is this one. I'm curious if the emergence of misinformation blowback that has caused uncertainty and consequently delayed vaccination rates cause resistance to lockdowns, using masks, etc., being included in the model or learning modules.
We've not dynamically incorporated misinformation. So it's not a misinformation does not dynamically occur in the model. However, certain parameters in the model are reflective of misinformation. So we've experimented with, for example, the willingness to vaccinate is a key parameter, and that I would guess that is driven by misinformation, and we considered that to be a a scenario, a parameter-driven scenario. And we've done significant testing on the impact of that on the overall pandemic, but we have not tried to model that as endogenously.
If I may add, Babek, very quickly. So we did have a bunch of discussions about this in the policy capstone. So we had, before running the simulation, a specific class to discuss the difficulties that misinformation causes for policy making and policy design. And I think that communication and misinformation was one of the key topics from the discussion with the panel. So it is not in the model, but it was in the process of learning about policy making.
Thank you, Luis.
And also in some stories, David talks about misinformation. So yeah, that's a big topic about COVID. The next question I would like to ask, there are some technical models. So Ali and Dan, if however you would like to answer to that, it says, you said the people's willingness to get vaccinated variable constant to 70%. Why didn't you assume it is dynamic and even oscillatory with death rates of different variants?
And do you want to add? I think Dan made that assumption to make just a simulation, simpler, to.
Someone asked me that in the chat, and I think that's one. No, I didn't respond to that one just yet. Is willingness variable in the population? I'm sure it is. We do have a module in the model which allows it to be variable, but we don't have good data on how variable it is, and unless so long as the general willingness is fairly high, allowing it to be variable doesn't make that much difference. If you already have 70% of the population that's willing to be vaccinated, then if the situation gets worse, then well, it can go to 75 or 80. It can't get that much higher, and that's one reason why the effect is relatively small. So when we start with a 70% willingness, which actually is the base willingness here in upstate New York, where I'm sitting, it is through much of the Northeast United States, having it be variable doesn't really add much. If you were doing the model for some other part of the United States, like parts of the South or Southeast, where the original willingness was probably somewhere in the range of 30 or 40%, then it probably would make a big difference. But I don't know how much of a difference. We don't have data, really good data on that. We would just have to pull some curve out of the air and use it.
Okay. And maybe I should add that in the model we have lots of switches, so we can activate or disactivate different parts of the model. So you can keep the willingness constant, not changing, shutting off the flow between unwillingness to willingness, or taking out another part of the structure. So if you look at the model and look at it carefully, by those switches, you can start with a simple model and then add gradually different structure and end up with a complete model.
I'd like to jump in here and say a little bit about model development. We've been meeting every Thursday afternoon on the East Coast time at 1 o'clock for the last 2 years. And as new things hit the news and as new things got worked into the diary, Ali and Dan reformulated and developed the model. And all of these questions have been under pretty much continuous discussion in that seminar. It's one of the most interesting ongoing seminars that I've ever been involved in. It's just been amazing because we're looking at issues as they develop and developing model structure real time to explore and do policy analysis by next week. It's been a lot of fun and very interesting.
Okay, great. Unfortunately, Luis is having another meeting and he has to leave. So thank you so much, Dr. Luna Reyes. That was a great presentation. Hope to see you soon. Okay, I
Thank you,
have
Babak, and
one
thank you, everyone.
question for Hyun Jang. That question is actually other people, David, Luis, and Dan, if you would like to answer. Questions for all speakers. Thinking over your career as a researcher and teacher, how have models related to COVID-19 changed interest in and use of system dynamics models? And in particular, have there been advances in teaching system dynamics and or related concepts, such as identifying, managing policy resistance? It starts with questions for all, Fernando.
Okay.
Yeah. So Hyun Jang, University of California.
So for my case, I took my teaching experience. So I'm teaching system dynamics to business undergraduate students. So COVID-19 is not particularly the topic that we are focusing on. However, it's a something that my students are experiencing, and it's something that they find extremely relevant and current. So we do incorporate conversation about COVID-19 and the dynamics and complexity whenever possible. And actually, before we go into the topic of diffusion model, like word of mouth dynamics, I actually have 1 week set aside so that my students can actually come in and explore this diaries during the lockdown project. And it's kind of like setting the scene for the diffusion model because it has the same initial structure. Okay, so yes, so in a way it's yes and no, because we don't cover it as a course topic, but then it is embedded into a lot of different ways. And I think my students are seeing how system dynamics can be useful outside the classroom. And it is awesome to see my student making those connections.
That's great. David, do you want to add the experience that you had at Capstone?
Yeah, I would like to say that I think there's been a lot of modeling work that's been done on COVID-19 that's caught attention, but it has not yet reached the level for teaching and learning of sophistication that I think there are in other fields. So for example, I think that the work that's out there, the teaching and learning being done on global climate change and the Rethink Health work is more sophisticated than anything that we've been able to present today. Those are teams that have been working much longer, have much more experience, and are just doing gangbusters work. So I would say that if God forbid COVID stayed around, for another 5 years, this class of modeling might get up to what we've been able to see in other policy areas, but it's going to be a long time before we're as good as the Rethink Health people or the global climate change simulators.
Okay, great, thank you.
Babak, we are a little bit over time.
Okay.
Maybe we can have a time for one more question.
Okay, great. There is just one question that's technical. I would like to ask Dan. I lost it. It was about. Unfortunately, I lost it.
Is that about the calibration?
No, I think we responded to the calibration. Dr. Mashoyke explained that. It was about the effects that it has on, okay, I found it. Big picture question here. How can these models be adapted to embrace one health paradigm? The human behavior response to COVID pandemia is unfortunately feeding back deleterious impacts on animal and environmental health, which were original root drivers of COVID pandemia, a vicious cycle.
That's an enormous assignment. Way beyond the capacity, beyond the competence of our little group. That's something that would have to be addressed by, say, some of the very large projects that David mentioned just a couple of minutes ago.
I've often thought a question that comes before this question, I think there's a very modelable dynamic process on the emergence of new variants as the virus cooks away within the human population. We handle that entirely as an exogenous event, as Dan said, it's just introduced. But I think that the emergence of new variants is an endogenous process ultimately. And as this question suggests, it's an endogenous process that may involve even more complex cross-species dynamics. I don't doubt that's true, but whoa, that kind of blows away. I would try to deal with the smaller question about the dynamics of variants within a single species, that is a human species. It's an important question that's being raised.
And certainly if you're going to introduce things like the emergence of genetic variation, which gets you into the realm of viral genetics, I don't think that system dynamics is the tool you need. So we'd have to have a multiple tool approach to this. Many different kinds of modeling and simulation.
You know, here on Newfoundland Farm, you know, just to make a funny quip about it, you know, there is an issue about cross species. There's currently an avian flu, which is taking down chicken flocks. We have a small chicken flock, and you know, we're getting notices from the you know, Cornell Cooperative Extension Service about it. So behind that is a huge issue about the dynamics of those avian viruses and how they hit poultry populations. And you know, from poultry populations, I suppose it's a hop, skip, and a jump to human populations. So there are people who are on a practical level knowledgeable about that, but it's a big deal.
Hard to do masking and social distancing with chickens.
All right, thank you all. I just want to, on behalf of the team, I just want to thank you for joining us and being patient with our presentations and waiting to the end. This is a very friendly group, so if you have any comments, if you want to join the team, if you have ideas, please feel free to share it with us. And thanks again. I will give the floor to Fernando.
Yeah, thank you, everyone. Thank you to all participants.
Thank you.
I'll ask the panelists to say some final words, but back before then, Hyung Jung, David, if you guys have Ali, maybe you guys have any words. Now is the time. Otherwise, I'm just gonna ask our participants to help us improve by sending their feedback. I'll send very soon an email with the link for a form so you can give us your feedback on this webinar. There's also other things coming up, so you can go to the site of the System Dynamics Society and search for the events. Under the menu of events, there's a calendar with a lot of events that you guys can join. Again, Hyung Jung, Dan and Babak and Luis that has to leave earlier, Ali and David, thank you so much for doing this. This was such a great webinar. I'm sure that we're going to be able to share all the materials and links that we talked here today. So allow us a couple of days to get all this to the website. Okay, everyone that is asking me about these resources that we're sharing today.
Thank you.
Thanks.
Thank you. Thank you so much.
Bye.
Bye.